Today, the Minnesota Senate opened hearings on what is expected to be major changes in health care on the way. The Republican-controlled Congress in Washington is debating bills to repeal the Affordable Care Act, also known as Obamacare. But replacing it in Minnesota might be difficult. Pat Kessler is at the Capitol this evening. He joins us right now. So, Pat, this is generating a lot of emotion.
Yeah, it really is. Repealing the Affordable Care Act will cause a major disruption all around the country, also here in Minnesota, and not just in how health care is delivered and paid for, but who gets it. Dolores Flynn, it's personal.
There's a picture.
The 72-year-old Roseville mother cares for her brain-injured son Scott at home with Medicaid help. Help she's afraid will disappear if Obamacare is repealed.
I want to scream. I cry a lot. It's extremely frustrating to see people choose money over people's lives.
The Minnesota Department of Human Services estimates the state will lose billions of dollars in federal funding if Congress passes the health care bills it's debating. By 2019, it will lose $2 billion, mostly in Medicaid funding. By 2022, $10.4 billion. And by 2027, $31 billion. For state lawmakers, it's doubly difficult.
We've led before, and we need to lead again.
A Senate Select Committee on Health Care is trying to get a handle on what's happening and what might happen in Minnesota.
We have to do whatever we can do in the Minnesota legislature for Minnesota.
But critics like Dolores say they will pressure lawmakers to repair health care, not repeal it.
Now, why don't they just improve Obamacare? Name it Trump care. I don't give a crap what they name it. That's right. But improve it and let people have health care.
Well, this will be a very big problem. One of the things, whether or not Obamacare, health care is repealed or not, it still is a huge cost with big problems here in Minnesota. It now comprises 32% of the state budget, Health and Human Services. And so that's something that a lot of people have to look at really seriously here, Amelia, and they're starting to do that today.
All right, Pat. Thank you.